get all your medical needs taken care of?
I didn't. We stayed on topic, but I have this thing to talk to him.
A cream will take care of that.
Yeah, I can fix anything.
Okay, so you're here, Dr. Ahluwalia. Always great to see you. And we're talking about breast cancer first. And there's this new study out that shows the earliest stages of breast cancer. Some women have the lumpectomy or mastectomy.
Right.
And it doesn't really affect the outcome in the end.
So there's various stages of breast cancer. This is stage 0. It's called ductal carcinoma in situ. What it means is that on the mammogram, they see some abnormalities in the milk ducts of the breast.
Okay.
And that's the diagnosis. So you have no symptoms.
Abnormalities, not cancer.
Well, so you have no symptoms. You go to the doctor, you get a regular mammogram. They come back and they say, we found something unusual. It's called DCIS, ductal carcinoma in situ. So far, the treatment for that has been a lumpectomy. So you go in and you take that area out, and then either radiation or some sort of a hormonal treatment. That's what has been done traditionally so far. But there's a fear factor, right? I mean, if you're diagnosed with some sort of a thing which is either pre-cancer or...
out.
Exactly. So women get either mastectomies or bilateral mastectomies in the hope that this will take care of the problem forever. And, you know, prior to 1980s, where mammograms weren't available, only about 100 or a few hundred were diagnosed with DCIS. Now it's 60,000 in the United States. So the question becomes is what to do if you have DCIS? It's this fear response, right? Just take care of it. A, there's no urgency to take care of the problem. It's not 2 weeks you need to do something. You can take a year, you can figure it out. The other thing is this huge study that they did over a long period of time, the death rates from invasive cancer from people who had lumpectomy, mastectomy, or nothing seem to be similar. So what they're saying is you're trying to avoid invasive cancer by taking either the lump or the whole breast out.
Invasive treatments, yeah.
So, you know, is it actually making a difference?
Okay.
So the problem is this study is not putting, you know, mastectomy, lumpectomy, no treatment together and following people. It's just seeing what happened over time.
So do you think you're going to hear more doctors saying, let's keep an eye on this?
Yeah, I think the key is, number one, this will help allay the fear of a lot of women that if you wait or if you watch, if you don't do something,
it's not a death
nothing horrible is going to happen.
Yeah.
But it also gives us the hope that as we look into this further, maybe DCIS wouldn't be that big a deal. Now, the caveat is if you're under 40 and you're diagnosed, if you're African American, or you have some molecular markers that show that it's going to be an aggressive cancer, all bets are off.
That's a whole
different.
But if you have none of these risk factors and you're just diagnosed with DCIS, maybe you should take a pause, get a second opinion, you know, not jump into surgery.
So stress, our next topic.
Yeah, so this
None of us have this.
None of us have this. So people who work more than 55 hours a week may be at higher risk of stroke and heart disease.
Yes.
So 55 hours a week is what they're considering a workaholic.
Should we just say Josh is going to, we should have someone monitor, executive producer. He could stroke out at any moment.
So what's interesting is, you know, we put 55 hours, but any hours over 40 just gradually increases that risk. So at 55, they said the risk of stroke is 33%. If you smoke, the risk of stroke is 50%. So think about it. Workaholics, smoking, I mean, it's really
Lack
bad.
of exercise, not enough sleep,
Stress,
food.
yeah,
all this
alcohol. I mean, these are all things that people who work longer hours do.
So what's the solution? Because if that's the business you're in and that's the job you're in,
right. Well,
you can't fall behind at work.
And I think it's a change in attitude. In the United States, we are probably some of the people who work the most. It's our culture. We feel proud of it. We take less and less vacation. Well, time to change that paradigm and, you know, take more time off, you know, spend more time with your family, work out, do things that...
There needs to be a focus on health and wellness.
because we're so focused on, you know, getting ahead that we've lost track of what health is about.
We have a little less than a minute left to talk about the female libido drug and
the pink pill.
The pink pill and the fact that you have to take it every single day forever.
Well, so first of all, people have labeled it the female Viagra.
But it's not.
It's not. Okay, so the male Viagra is a blood flow issue.
And then boom, you're ready to go.
This one is more of chemistry in the brain. The second thing is that it's marginally effective. It
was one sexual experience a month if you're lucky?
So if it works on you, that's great. If it doesn't, I wouldn't be too surprised. The second thing is just remember that it drops your blood pressure precipitously. So make sure you don't drink any alcohol with it. And make sure it's for a legitimate reason. It's not one of these things, you know, oh, I just want to get in the mood, so let me take a pill. It doesn't work like that.
It's quite an investment because you have to do it every single day.
Exactly. But for the first time, women have something
hope.
Regarding
Perhaps.
sexual issues that we
Yeah.
hope will get us more drugs or more treatments in general to
So
help.
really quick, before that, people were just doing what, hormone replacement? I mean,
This is premenopausal. This is not for postmenopausal. This is
Okay.
premenopausal. So
Yeah.
if you just have low sexual interest and desire,
there was nothing.
There was nothing.
Okay.
Okay.
All right. Thank you,
Dr. A,
Dr.
thank
Ahluwalia.
you.
Always good stuff. Coming up a little later, are you ready? We
For some
are taking
football.
on the women
I gotta watch
football
this.
players from the LA
Someone's gonna get hurt.
Temptation. Last time we were here,
Steve pulled a groin.
Steve had to
remember?
come
Oh,
see
that's
you.
what the, yeah.
He hurt himself.
You might want to
so
just
bad.
stay.
I know, on the sideline.
Can we just have you on call in studio?
But up next, one of the stars of the new horror flick, The Curse of Downers Grove.
It's scary.
Disaster.